Hi, everyone. This is Sharon Meyer speaking. I'm the Integrative Nutritionist and Functional Nutritionist at the Institute for Health and Healing. And the Institute for Health and Healing is the integrative program for SATA. So today we're going to talk about hormones and how food can impact our hormones. So when we talk about hormones, there are so many of them in the body. There are about 50 of them. And they are part of the endocrine system. And what are they? Well, they're actually chemical messengers. So they go from the brain to the body, through the blood to specific cells. And these cells are also known as target cells. And then they bind to the receptor on these target cells. And then that specific cell is activated, and that creates a whole chain of reactions that dictates that particular cell. So if we're thinking about an estrogen cell, then there's a whole slew of information to that estrogen cell to activate it. And so that's how we think about hormones. So the hypothalamus and the pituitary glands are the master glands, and they are involved with our metabolism, our energy, our weight, mood, and digestion. So when we think about hormones, if there's an imbalance in one hormone, that can cause an imbalance in many of the other hormones. So it's a sort of whole symphony of how these hormones work together. So if there's too much of one, there can be little less of another, and that can impact the function of our body. So let's talk about another organ. So fat or adipose tissue, it's considered to be part of the endocrine system. And the reason why fat tissue is kind of classified as part of the endocrine system is because it contains nerve cells, blood vessels. It stores and releases energy to fuel our bodies. It's involved with glucose control. It releases different substances. It releases hormones, something like 17 different hormones that can be very, very pro-inflammatory in the body. It is involved with our metabolism. It has an impact on our estrogen and progesterone levels, and actually even testosterone. So fat tissue plays a huge role in how our hormones function in the body. And again, it comes back to that whole thing with fat, is that it's a two-way street where hormones can actually affect the body fat, and your body of fat can affect the hormones. So the next hormone we're going to talk about is one that you're probably well aware of, and this is insulin. And insulin affects many, many hormones in our body, including estrogen, progesterone, and testosterone. So insulin is also known as the fat storage hormone, and its main function is to escort glucose into cells. One of the problems is as we age, our carb or starch tolerance diminishes, and then glucose amasses in the bloodstream. And in response to that, the pancreas secretes more and more insulin to help eliminate that excess glucose. And we can end up with what is known as insulin resistance. And insulin resistance is really problematic. It's really about where more insulin gets secreted in order to try and move that glucose into the cells. And when we have this, the liver will try and convert that extra glucose into fat. And so we start to talk about things like fatty liver disease, etc., high levels of triglycerides, that kind of thing. But insulin resistance also increases our blood pressure. It involves our vascular disease. It also is a risk factor for cancer, Alzheimer's, and other brain issues, mood, depression, and anxiety. It increases inflammation, and the increased inflammation can lead to cortisol production, which results in further insulin resistance and fat storage. And we know that insulin resistance can also impact our microbiome. So when we're talking about hormones, insulin can also lead to what is known as estrogen dominance, and we'll talk a little bit more of that as we go through this. It also stimulates the ovaries to produce more testosterone, which can lead to polycystic ovaries. It also inhibits sex hormone binding globulin, also known as SHBG. And SHBG is what is known as, it's our carrier molecule. So it carries the hormone through the body. And we want to have enough of that particular carrier molecule, because if we don't, then we have high amounts of these hormones that can fluctuate in the blood through the body. So a carrier molecule is definitely means is that it helps to balance our hormones too. So let's talk about the stress hormones. They really are important for how we manage our stress, right? Stress hormones manage stress, makes sense. Adrenaline is our short-term stress hormone, and cortisol is our long-term stress hormone. And we've heard and spoken a lot about cortisol since February right through to now. And now with the addition of the fires and the smoke, it's also probably pretty high with most people. But it's actually essential for life. It's our long-term hormone, our long-term stress hormone. It's essential for life. The problem is really about the balance of this, right? Not too much, not too little, kind of the whole Goldilocks aspect to this. We want to have it balanced. So adrenaline starts the fight or flight function in the body. And then cortisol increases various things in order for you to be able to flee or fight that the lion in the veld or the saber-toothed tiger. So cortisol increases glucose in the bloodstream so that you can run or fight the thing adequately. It enhances the brain's use of glucose, so you can think about how you're going to be dealing with the stressor. It readies the body for tissue repair, so if there's some damage, you can repair that and do the fighting or fleeing. It slows down the non-essential functions. So during the fight or flight, so things like immunity, it suppresses our reproduction and our growth hormones. It's involved with reducing all of our sex hormones, because we don't need that when we are in this high amount of stress, right? So from an evolutionary standpoint, our stress is really a perception of stress, right? Because there is no lion in the veld that we're running from, but it's our thoughts, which is great because it's manageable to a point if you've got some tools as to how to deal with this. And I think if you've been listening to some of these wellness talks, you've probably heard that we have our 3 therapists, and they've been giving you some of those tools to deal with us. But what happens with cortisol when it stays elevated, that gets to be the problem. So it raises our blood sugar, and we end up with this brain fog, and then our blood sugar crashes, we get hungry, we eat more carbs, we get hangry, we eat more sugar, and it starts that whole cycle of high insulin and blood sugar, low, high, low, high, low. It also impacts how we sleep, so we end up feeling we don't sleep that well, and we end up feeling tired but wired. It raises our blood pressure, it affects the brain, it shrinks the hippocampus, it interferes with our memory and our emotions. And what's interesting about cortisol, it has 4 times the amount of cortisol receptors around the waist, our visceral fat. So what happens is that you end up gaining more weight around the middle. And I've heard this from lots of people. My diet hasn't changed. I'm still exercising. Well, they're not exactly exercising, but those things haven't changed much, and they're gaining the weight around the middle. Cortisol receptors around the waist area, and especially around the fat tissue. And then it ends up with doing this whole pregnenolone or progesterone steal. So how that works is cholesterol is the mother of hormones. It gets converted into pregnenolone. And pregnenolone can go in the direction of our stress hormones, or it can go into the direction of our sex hormones. Now, when we get very stressed, that pregnenolone or progesterone gets converted into our stress hormones, so we can make more cortisol. So that gets to be the whole problem with our cortisol level. So how do we change that? Well, breathing makes a huge difference. If we can just stop and take a breath, and if you have any kind of routine or something to remind you to take a breath and just count to 10 and do 10 breaths, it has a massive impact on your body and your system. So then let's move on to the next, and then we're talking about our sex hormones now, or actually we're not. We're talking about the thyroid. So the thyroid is your butterfly-shaped gland, and that's at the base of the throat. And it's considered to be the master conductor of our symphony of hormones. It's involved in our heart rate, our body temperature, fertility, our mood, metabolism. And it's also involved in converting that cholesterol to pregnenolone. So sometimes when I see people with very high cholesterol levels, I'll talk a little bit about what's going on with the stress. Because if you have a lot of stress, then we're seeing high amounts of cholesterol in order to be able to make those stress hormones. Okay. So the thyroid hormone is one of the very few hormones that engages with every single cell of our body. And like all hormones, it's involved in a feedback loop. So the body sends a message to the brain to the gland, and then back again. So it's pretty much, it gets turned on and it gets turned off. So when we see symptoms of low thyroid function, those are going to be things like fatigue, weight gain, poor sleep, dry skin, hair loss. And did I say fatigue and weight gain? Very, very typical. So then moving on to our sex hormones, we're going to talk about estrogen. So estrogen is commonly known as the female hormone. You know, it helps with making our hips and our breasts, but it's also involved with brain function. It's very anti-inflammatory. It's also involved in supporting our mitochondria, which helps to make our energy. It helps reduce pain too. And a lot of times patients will tell me when they're going through perimenopause or menopause, women that is, and they'll say that they start to feel the pain in their joints and which they weren't feeling before they went into these phases of their life, because estrogen is so very anti-inflammatory, and as I say, it almost works like an analgesic, helps to reduce the pain. Estrogen is involved with our bone metabolism. It's very good for the heart. And the big thing about estrogen is when we start to see a drop in estrogen, we can see an increase in that visceral fat too. But what's fascinating is that fat tissue can also help produce more estrogen. Now, we end up with what is known as estrogen dominance, meaning too much estrogen in relationship to progesterone. Progesterone is our calming hormone. It helps us sleep better. It's a very important hormone, but it's about how we balance that estrogen to the progesterone. So here I'm going to, estrogen dominance refers to an excess amount of estrogen when your progesterone levels are inadequate. And this normally occurs when women are going through their reproductive years, but it also tends to be particularly symptomatic for women during perimenopause and in menopause. So estrogen dominance is always worsened when women are not ovulating or when they're being exposed to high numbers of synthetic estrogens, and when they are not metabolizing estrogens correctly. So when we want to make sure that we break down or metabolize those estrogens through phase 1 and phase 2 of the liver and clear them out of the body. So what does estrogen dominance look like? Bloating, weight gain, breast tenderness, headaches, moodiness, fibroids, endometriosis, heavy periods, and the weight gain is around the waist. So one of the things that we know with estrogen dominance is high insulin can impact that. Dairy and meats, if they're not organic or pasture-raised, high with all the hormones. Remember, if we think about milk, for example, or dairy products, it's a very high hormone food. Comes from a lactating animal. And there are a lot of hormones in there to grow a different or a new animal, like a little calf or a kid or a goat. So we've spoken about all of those things. So I just want to say about progesterone, it's our calming hormone, and we want to make sure that we have it in balance, right? So what are the foods? So the plan really looks like this. It needs to be a low-carb diet because, as you can see, insulin plays such a huge role in how it impacts all of these different hormones in the body. Remember, it's this two-way street with our hormones. They all work together in the symphony, and when we have too much of one, it can impact a lot of the other hormones. So we've got to control that insulin, and we do that with a low-carb diet. And it should be under 100 grams. And then the foods we want to avoid are going to be sugar and then those starchy carbs. So things like bread and pasta, rice, that kind of thing. It all has to fall under 100 grams. Definitely no gluten. When we think about gluten, we think about how the thyroid doesn't function that well, Hashimoto's. So gluten needs to be cut out. Alcohol plays a huge role in impacting our hormones very negatively. So reduce the amount of alcohol, especially when it comes to sleep. And we know that that's very problematic, and you can end up feeling that sort of tired but wired. So cut the alcohol or definitely reduce it. Gut health, constipation. If we don't poop, ladies and gentlemen, we are going to retain those hormones and they don't get excreted and they recycle through the body. So constipation plays a huge role, and thereby your gut as well, or your microbiome. And if you're overweight, now is the time to really lose it. I have a program that starts on the 24th of September next week. Join it if you need to lose this weight, but it's really important now. Remember that the body fat produces more hormones, 17 of them, and particularly estrogen. So what would you eat? The cruciferous vegetables, at least 1 to 2 servings of those per day, and that's going to be broccoli, cauliflower, kale, Brussels sprouts, cabbage, bok choy, all of those, 1 to 2 servings. And then about 5 servings of the other vegetables per day. Lots of leafy greens. Protein, about 4 ounces of that 3 times a day would be good. This is clean protein, and don't do dairy. Good oils, olive oil, avocados, olives. Fruit, watch the fruit. Too much of that can raise your blood sugar and thereby impact insulin levels. So 1 to 2 per day, servings that is, and a serving would be a cup of berries or 1 small apple. Nuts and seeds, 1/4 cup per day. 0 to 1/4. I rarely get people to measure the amounts of nuts and seeds that they consume because it's easy to open up a bag and just eat nuts, right? Legumes, you could do 1/2 cup per day. But that would be the foods that you would be eating, right? And this is about how do we balance those hormones. There are many different programs that we can talk about, some of the other diets that are involved, but generally, this is how we do this. It's about how do we eat well to support the entire body, but also to keep our hormones very well balanced. There are supplements, but supplements are what I like to use for patients on a personal program. Thank you. Couldn't get that out for a second. Well, thanks, folks, for joining. Take good care. Bye-bye.